Back now with Dr. David Schultz from Evansville Primary Care, taking your questions tonight about the coronavirus. And Dr. Schultz, we talked about this a little bit last week, but over the weekend, hospitals reported more younger people in their 30s and 40s who have tested positive for COVID-19, that they're having strokes. And these are people who are otherwise healthy, taking no medications, and had no underlying health conditions. Why are we seeing this?
Well, Brandon, there are two reasons why we are seeing this phenomena in younger people. The first reason is because when people are getting sick with this infection, they're becoming sedentary. They're not able to move, and some of these are sick enough that they're in bed, and so that's a setup for developing thromboembolism, which are blood clots and so forth. The other reason, which is more importantly, is because COVID-19 causes a systemic response out of your whole body. And the systemic response also affects the blood pathways that causes blood clotting and coagulation. And as a result, it starts a domino effect where it causes your ability to clot to be messed up. And as a consequence of this, it's able to make blood clots in people at higher risk who are especially ill systemically with this infection. So it's a phenomena of the inflammatory response of the infection to your body.
Okay. We had a viewer just call in wanting to know if they need to show all of the symptoms to have of COVID-19 before they can be tested or not.
Well, there's several factors involved in that. We're still limited on testing, but more testing is available than what we had the other week. And as a consequence of this, we're actually testing more people and finding more positive cases. But one of the things we're looking for is, first of all, the fever of 100.4 or higher. That's very strongly suggestive. The cough, the congestion, body aches, myalgias, and some of those other symptoms that we previously talked about. So the more of the symptoms that an individual has, the more necessary it is to get that test. The other thing they look at are people that are involved in healthcare and those who are helping with the elderly who are especially vulnerable.
Another viewer wants to know that they have a regular follow-up appointment with their doctor soon. Some doctors are now offering telehealth, but is it safe to go to the doctor's office for the visit?
Well, Brandon, it's really dependent on the office policies that have been set up by those individual offices. And granted, each office has a little different slant or method of how they're going about that. In our office, for example, we are trying to filter out those who have any type of respiratory infection away from the other individuals. And largely, we've seen a lot of success with that. A lot of times, we will also ask about what types of symptoms does a person have? Have they had any of these symptoms in the last 48 to 72 hours? And we try to isolate those individuals as well. So most offices are doing such a practice. Most offices are also masking when you're there. And then most offices are slowing down the number of appointments available for their entire day. And an office that does those things should be a relatively safe office.
Dr. David Schultz with Evansville Primary Care, thank you so much for being with us again tonight. We'll talk to you again tomorrow night.